Collins Trott, Child Development Faculty on the Wallace Community College Dothan campus. In this episode, we are going to be learning about the purpose, process, and practice of monitoring, screening, and evaluating. It is essential that early childhood educators be able to recognize typical from atypical development. With typical development, there are certain behavioral expectations and developmental milestones that children should master within certain age ranges. Any behavior and development that falls outside of the standard norms would be considered atypical. As early care providers, how do we know whether a child's development is happening at a normal, excelled, or delayed pace? How can we be certain that we are providing an optimal learning space for each child? As intentional teachers, our goal is to accommodate all the varied skill levels and diverse needs of the children in our classrooms. Additionally, we must provide a safe, nurturing, and culturally respectful environment that promotes inclusion so that all children can thrive. In this episode, we will focus on the following objectives. Number 1. Explain the purpose, process, and practice of monitoring, screening, and evaluating young children. Number 2, compare the various tools to monitor children's development. And 3, detail the resources and services that are available to support children and their families. So join me, Ms. Trott, as we learn all about the purpose, process, and practice of monitoring, screening, and evaluating. Because many parents are not familiar with developmental milestones, they might not recognize that their child has a developmental delay or disability. What's more concerning is that many children are not being identified as having a delay or disability until they are in elementary school. Subsequently, they will not receive the appropriate support and services they need early on to be successful at school. It has been well documented in both educational and medical professional literature that developmental outcomes for young children with delays and disabilities can be greatly improved with early identification and intervention. As early childhood educators, we have an obligation to help families navigate through the process of monitoring, as well as provide information and resources if a screening or evaluation is necessary. Parents, grandparents, early caregivers, providers, and teachers can monitor the children in their care. By monitoring a child closely, not only can we observe how a child grows and develops, we can track changes over time. More importantly, we can identify children who fall outside of the parameters of what is considered normal or typical development. When teachers monitor children, teachers are tracking a child's speech and language development, problem-solving skills, fine and gross motor skills, social skills, and behaviors, so that they can be more responsive to each child's individual needs. Even more so, teachers are trying to figure out what a child can do and if there are any red flags or developmental areas that need further support. As early caregivers and teachers, we are not qualified to formally screen and evaluate children. We can, however, monitor children's actions, ask questions that can guide our observations, track developmental milestones, and record our observations. With this vital information, we can make more informed decisions on what is in the best interest of the child. With many busy children in a classroom, there are bound to be occasional outbursts and challenging behaviors to contend with. Without taking the time to observe the potential causes and outcomes associated with the challenging behaviors, we may only be putting on band-aids to fix a problem, rather than trying to solve the problem. As intentional teachers, we are taught to observe, document, and analyze a child's actions so we can better understand what the child is trying to tell us through their behavior. Behavior is a form of communication. Any challenging behavior that occurs over and over is happening for a reason. If you can find the pattern in the behavior, you can figure out how to redirect or even stop the challenging behavior. If while monitoring a child's development, a red flag is identified, It is the teacher's responsibility to inform the family in a timely manner about their child's developmental progress and develop a plan of action together. With a plan in place, the teacher would continue to monitor the child. If after a few weeks there was no significant change or improvement, the teacher may then recommend that the child be formally screened and evaluated by a professional. Screenings and evaluations are more formal than monitoring. Developmental screenings take a closer look at how a child is developing using brief tests. Your child will get a brief test, or you will complete a questionnaire about your child. The tools used for developmental and behavioral screenings are formal questionnaires or checklists based on research that asks questions about a child's development, including language, movement, thinking, behavior, and emotions. Developmental screenings are cost-effective and can be used to assess a large number of children in a relatively short period of time. There are screenings to assess a child's hearing and vision, and to detect notable developmental delays. A developmental delay is a condition of a child being less developed mentally or physically than it's normal for their age, whereas developmental disabilities are a group of conditions due to an impairment in physical, learning, language, or behavioral areas. Screenings can also address some common questions and concerns that teachers and parents alike may have regarding a child's academic progress. Beyond monitoring, once a child has been red flagged, they will need to be assessed by a professional who will use a formal diagnostic tool to evaluate the child's development. Depending on the nature of the red flag, there are a battery of tools that can be used to evaluate a child's development. Some of the developmental and academic screening tests that are widely used in Alabama are Ages and Stages Questionnaire, also known as ASQ, and Dynamic Indicators of Basic Early Literacy Skills, also known as DIBELS. To quickly capture a snapshot of a child's overall development, early caregivers and teachers can select from several observation tools and observe and document a child's play, learning, growth, and development. Systematic and routine observations made by knowledgeable and responsive teachers ensure that children are receiving the quality care and support they deserve. There are many factors that can influence a child's development: genetics, gender, social interactions, personal experiences, temperaments, and the environment. It is critical that educators understand what is typical before they can consider what is atypical. Developmental milestones provide a clear guideline as to what children should be able to do at set age ranges. However, it is important to note that each child in your classroom develops at their own individualized pace, and they will reach certain milestones at various times within the age range. Developmental milestone charts are usually organized into 4 domains: physical, cognitive, language, and social emotional. Developmental milestone charts are essential when setting up your classroom environments. Once you know what skills children should be able to do at specific ages, you can then plan developmentally appropriate learning goals, and you can set up your classroom environment with age-appropriate materials. Several observation tools and techniques can be used by teachers to screen a child's development. Because each technique and tool provides limited observation data, it is suggested that a teacher uses a combination of tools and techniques to gather a full panoramic perspective of a child's development. Some of the more commonly used tools to monitor children's development are frequency counts, checklists, technology, and event sampling using the ABC technique. When early caregivers and preschool teachers practice monitoring as part of their regular routines, they demonstrate accountability and responsive caregiving. Nearly 65% of children are identified as having special needs, disabilities, delay, or impairment, and some require special services or interventions. As early educators, our role is twofold: provide an environment where the child can feel safe, secure, and cared for, and help children develop coping skills to decrease stress and promote learning and development. Some children may need more individualized support and might benefit from specialized services, or individualized accommodations by having an individualized family service plan, IFSP, or an individualized education program, IEP, in place. To ensure that all children feel safe, secure, and nurtured, teachers must strive to create a climate of cooperation, mutual respect, and tolerance. To support healthy development, teachers must offer multiple opportunities for children to absorb learning experiences, as well as process information at their own pace. Teachers who are devoted to observing their children are motivated to provide experiences that children will enjoy and be challenged by. In order to maintain a high-quality classroom setting, it is essential to utilize your daily observations of children and the environment to monitor the experiences and interactions to ensure there is a good fit. Now, let's review what we've learned. Monitoring, screening, and evaluating children is both necessary and takes time and practice. Rather than waiting until there is a major concern, intentional teachers should conduct observations on a regular basis to closely monitor each child's development. By watching children, we can find patterns. Once we understand the patterns, we can better understand why children do what they do, and ideally, we can create an inclusive learning environment that meets the needs of all of our children. Understanding that over half of the children in your classroom may potentially have some special need, disability, delay, or impairment is crucial. Recognizing that unless we observe regularly, we won't be able to refer families in a timely manner to get the support services and professional help they need. Research tells us that children who receive early intervention are more likely to master age-appropriate developmental milestones, have increased academic readiness, and are more apt to socialize with their peers. It is important to remember that everyone in the classroom, including teachers, assistants, and directors and supervisors, should be involved with monitoring a child's development. That wraps us up for this episode. You can learn more about this topic by reviewing the resources posted in your course. As always, if you have any questions, please contact me or your instructor. Thanks for joining me, Miss Trott, as we learned all about the purpose, process, and practice of monitoring, screening, and evaluating. See you next time.